What is it I mean when I say mental health and physical health, they are the exact same thing? It's a real mystery to me why we even have two separate concepts at all. Why do we talk about mental health as being something different from physical health? We don't talk about heart health as if it were separate from our physical health. No one questions that healthy lungs are related to physical health. But when we start talking about the brain, another body organ, things get very confusing very quickly. As a psychiatrist, I attended medical school for 4 years, just like my other physician colleagues. I studied anatomy in the cadaver lab. I did rotations in internal medicine, neurology, surgery, obstetrics. Love birthing babies, by the way. And all my other colleagues had to go through psychiatry rotation during medical school as well. So why is my organ system considered a different realm from those of other doctors? Why is there a stigma attached to mental health that isn't attached to most other health conditions? This is something I'd like to speak about briefly today because, frankly, we're in the middle of a less acknowledged health crisis right now. Another parallel pandemic. Given the recent stressors in the world, COVID-19, divisive politics, global warming, geopolitical unrest, just to name a few, we are seeing an onslaught of depression and anxiety in all ages and all walks of life. And I think it's time we stop treating mental health as some separate, unrelated process to overall health. After all, every physician is dedicated to their patient's global well-being, whether it's listening to their lungs for pneumonia or asking a series of questions to determine the state of their mood and quality of life. I don't somehow imagine that their physical health stops at their neck, but that's how we often conceive of it. We often think that someone struggling with a chemical imbalance affecting the way they think or feel is different than someone whose bronchioles in their lungs are constricting when they encounter an allergen, in other words, having an asthma attack. And we certainly don't call people with asthma or diabetes weak or blame them for their illness. If someone's lying on the ground having a heart attack, no one would run up and say, "Come on, stop acting like that. Just pull yourself up by their bootstraps. Make that heart beat." However, when it comes to diseases in my world, people have a tendency to do just that. We have this belief that we are in charge of our brain. The reality is our brain is in charge of us. And when it starts to act in an unhealthy fashion, when it's not operating properly, it's not a simple matter of willing ourselves out of that mental state, any more than we can will ourselves out of diabetes when our pancreas has decided to give up the ghost. But as human beings, we do not like the concept that somehow our personalities, who we think we are, who we believe ourselves to be, is dependent upon the healthy operation of, albeit, an extremely complicated organ. When our heart is not beating properly, well, that's not our fault, it's out of our control. But when our amygdala is firing continuously, as in anxiety or obsessive compulsive disorder, well, that's something we should just get over. For a while, I moonlighted as a consult liaison psychiatrist at several of our local hospitals here in Pittsburgh. This is essentially a hospital specialty, just like pulmonologist, cardiologist, hospitalist. Only I would get called for behavioral concerns or behavioral emergencies. When the hospitalist would run into the patient's room, everybody would shout, "Hooray, here's the doctor!" Or when the cardiologist shows up, people feel a sense of relief since they've come to save their loved one from the ravages of a heart attack. When the psychiatrist shows up, the first question is usually, why are they here? Once again, it's the idea that there is something different about our brain than our other organs. Admittedly, there's little doubt that a change in our personality or thought process is a terrifying way in a very different manner than a heart attack might be. It goes to the very core of who we are and affects not some physical part of our body, but cuts right to the core of our sense of self. But in reality, mental health and physical health are inextricably interwoven. Depression and anxiety have very clear physical effects on the rest of our body, including lowering our immune response, increasing inflammation, adversely affecting digestion, dramatically changing the way we perceive and deal with pain. And this is just a small number of examples. We also know that physical illness directly affects our mental state. So it's time we stop trying to see mental health as something other than what it is, the physical health of our brain. Another real challenge when it comes to understanding illnesses such as depression or anxiety is that people often feel that they can somehow relate to the suffering of the patient in a way that's often inaccurate and invalidating. The problem is that the severity of an illness is not the same for each individual. I like to tell people that because you've had a sprained ankle, you don't know what it feels like to have a broken leg. While they're both pain in the lower extremity, the degree of discomfort is quite different. Someone who's managed to pull through the blues does not know what it's like to suffer from clinically debilitating depression. I mean, it's like somebody with a sprained ankle telling somebody with a broken leg, if I can walk it off, you can walk it off. Look, what I'm really trying to convey is that health is health, and illness is illness. When you're having severe chest pain, shortness of breath, combined with real trouble walking up the stairs, you don't judge yourself. You hightail it to a cardiologist because your heart health is suffering. If cells are mutating out of control into something that they shouldn't be, you go see an oncologist because that's called cancer. When your feelings are out of control, you no longer see the joy in life. You're too scared or too worried to leave your house or interact with other people in a normal, healthy fashion. Or you're hearing or seeing things that other people are not, then you go see a psychiatrist because that's an unhealthy brain state. So I've said it before, and I'm going to keep on saying it. Mental health and physical health, they're the same thing. Please don't forget to subscribe to my channel and give it a thumbs up if you found this video interesting and helpful. See you next time.